with their bladder is unless you take time to do it right, don't waste your time doing it because you will be right back where you started from. I had one patient call me uh, when I was working with my collaborator at the time. He had done her pelvic lift, and I called to check on her and asked, "How you doing?" "Oh, I'm doing fine." I said, "Well, are you getting plenty of rest?" "Oh, well, I did for a few days, but right now I'm out painting the house." Well, guess where we found her a few years later? Right back in our office to have the same thing done again. So you have to use common sense. If you've had surgery for this issue and you don't want to do it again, please pay attention to the instructions. If you work on your feet regularly and you do heavy lifting, you may want to get a binder. You see the people who deliver the delivery man that brings things into the grocery store. They'll have these black Velcro uh, binders around their lower abdomens, and that's to help support your core, your back muscles, your abdominal muscles. Exercise is a really good thing to employ. If you can strengthen the core muscles, that will help to ease that bladder leakage. So think about an exercise program. Abdominal muscles that are stretched with pregnancy, or if you gained a lot of weight and then you've lost it, and you have all this flabby fat hanging here, you've got to exercise, ladies. It doesn't just immediately evaporate. So tighten your core. There are a number of things you can do. The good old fashioned Kegel exercise is not to be underestimated. Now, for those of you out there who do not know what a Kegel exercise is, that is an exercise. I can do it while I'm sitting here, and you never know I'm doing it. You would tighten the same pelvic muscles that you tighten when you're trying to stop or hold back the flow of urine. You would tighten that muscle group and hold it for about 10 seconds and then relax. There's a way that you can do it while you're lying down. You simply lay flat on a surface. It can be your bed. You can do it in the morning before you get up. And you push the small of your back down into the mattress or down onto the surface that you're lying on. And that will help lift those muscles and tighten them. And it's very, very effective. You can do the Kegel exercises 3 to 4 times a day, a set of 10. Do it while you're sitting at a traffic light or a stop sign. Do it when you're sitting in a meeting. Do it when you're doing nothing, watching TV. But that is very effective. When I have a lady in the office, one of the things I ask her, any problems with your bladder? And she said, well, I have to be careful coughing or sneezing, and jumping on the trampoline is out of the question with my children and all. So when I do the pelvic exam, we do what's called a bimanual exam. And that's, ladies, after you've had the speculum exam, maybe a pap smear was done, then the provider will examine your pelvis manually. And usually I will put 2 fingers in the vagina and I'll ask the lady, can you tighten your muscles around my fingers like I was trying to pull them out? And oftentimes I can't feel her move at all. And she'll say, I'm tightening now. And I said, well, the problem is your bladder hasn't dropped down. You just have no muscle tone. Surgery will not fix muscle tone. Surgery will lift a bladder that has relaxed and fallen down, prolapsed into the vaginal vault, but it will not help poor bladder tone. The only thing that is going to help that is exercise, tightening those muscles, strengthening those muscles. So if you are having some problems with leaking from your bladder, the first thing to do is go in for a pelvic exam. And when we inspect the vaginal area, we can see if your bladder muscle has relaxed, causing the bladder to drop down. If it hasn't, if the bladder's up pretty well where it's supposed to be, Then we'll do the pelvic exam, and we can assess your pelvic tone. And if it is pelvic tone, actually, there are physical therapists in our area who specialize in tightening the female pelvis and the pelvic muscles. We have a really great lady over here in Florence, Dr. Megan Eck. ECK is her last name. Megan and I work together quite a lot on helping patients restore their pelvic tone. And the way she does it is she teaches you exercises to use that will tighten the tone. Now, if you've been in my office, you've probably seen an array of gadgets that we created to help with different issues. We have some that help with orgasm. We have some that help with different things. But you'll also notice a little set of what we call Kegel balls. And these are little non-latex. Well, I have them made from medical grade silicone, but they're little balls. There's a ball inside the ball, and it has a little thread that hangs down. You push the ball up into the vagina, and to hold it there, you have to tighten your muscles, or your little Kegel ball is going to go rolling across the floor. The ball inside the ball, when you move, it moves, and it gently tells your brain, hey, tighten up to hold me in here. And those are very, very effective. So if you can't make yourself do a Kegel exercise just sitting around, you might want to try the Kegel balls to hold them in. I suggest people, when they buy a set, we have a set of 2 for, I think the office sells them for $100. And again, they're non-latex. I suggest that people put the ball in the vagina while they're sitting around watching TV, because it does take a little time for you to adjust to it being there and to adjust your muscle tone to hold it in place. I tell them you don't want to be at Walmart and lose your balls in Walmart. So get used to them at home before you wear them out. But many times the ladies will tell me, well, after wearing it for a week or so, I don't even know it's in there. So I just wear it all day, and that keeps my muscle tone tight. The only complaint I've had with the Kegel balls is from a husband who said it made his wife too tight. So I'm sure that's an issue that they got worked out one way or another. Estrogen use. If your tissues have gotten thin, what happens is the tissues around the bladder opening dry out, and then they start to atrophy or shrink up, and they pull back, and so the opening to the bladder is not as tight. You can get, an estrogen cream to use. You can massage it around the bladder opening once or twice a day, and in a little while, those tissues will become moist and plump again, and they tighten up. So if the bladder tone is a problem because of the weakness of the tissues that have lost all their estrogen, this is something that you may want to think about. Now, there is also a surgery that can be done. They do them different ways, and of course, I'm not a surgeon. I'm a nurse practitioner, but I have a number of excellent surgeons in our area that I can refer you to if the bladder has fallen down. And the most common reason that happens is the heavy lifting and standing on your concrete floors daily, or having big babies. And that sometimes prolapse is just not helped a lot by the Kegel exercises. I refer you to the surgeon, and he evaluates your bladder and tells you, if it would help, if it wouldn't. He or she tells you how the procedure would be done and what your expectations can be. But they also give you a follow-up plan after surgery. And again, you really need to listen to that, or you're going to be right back where you started from on that. Another thing that you can do to help with bladder prolapse is lose some weight. The study has shown that for every 17 pounds that a woman loses, her bladder lifts significantly. So if you are heavy in your pelvic area. Your abdominal muscles are loose and flabby and have a lot of fat. Consider weight loss as your first step. A lot of times you can help yourself without buying a pill, having a surgical procedure, doing too much of anything. So, weight loss is something that you can do at home. Remember, every 17 pounds that you drop, your bladder function is going to improve there. Now, let's say that frequency or urgency. There's what's called stress incontinence with urgency. And that's where when you've got to go to the bathroom, you've got to go to the bathroom. So everybody get out of the way, or I'm going to go before I get there. And that can be controlled with medication. It's very unpleasant for a woman to go on a shopping trip, and the first thing before she starts shopping is to find out where the bathroom is. Many women in our area can tell you the location of the bathroom in every store in the mall and every gas station that has a clean restroom, things like that. Frequency and urgency isn't a pleasant situation. Sometimes it's caused by infection. So if you've suddenly developed this problem, the first thing to do is to check for a bladder infection, a urinary tract infection, rather. And that can be done easily in most medical offices. You simply get a urine sample, and they dip a little stick in it that has a lot of little colored squares on it, and they look for overgrowth of bacteria, overgrowth of different things. Sometimes you'll have symptoms, and sometimes you may not. Now, I will mention to you here, if you say, well, I have a history of kidney stones, so I heard all the time. When they dip that little stick in your urine, you're going to see blood there. But a lot of times you don't have any symptoms. Kidney stones generally do not cause incontinence. It's more of the inflammation of the bladder lining associated with infection, overgrowth of bacteria, irritation, things like that. Now, for the sexually active women out there among us, rough sex, and sometimes when you're in a sexual relationship, you get a little playful and a little frisky, and sex goes on for a while, and this can irritate the female bladder. The opening to the bladder and the opening to the vagina in a woman are very, very close, and simply the motion of intercourse can irritate the bladder. So, guys, if you're having prolonged sexual session, and your partner needs to take a break for a minute, it's probably number one to empty the bladder, or number two to just give the bladder a little bit of rest, because bumping against the bladder is not going to hurt it, but it doesn't feel that great sometimes. So you alter positions, change positions, check with her, ask her. Someone will tell you, hey, this isn't working for me like this. I need a position change, or simply shift your hips a little bit. Now, remember, after sexual activity of any kind, you do need to urinate, ladies, because the bacteria from sexual encounter can enter the bladder, even if it's oral sex. There's a lot of bacteria in the mouth. So if you have sexual activity, as soon as you're finished, urinate, go to the bathroom, and empty out some of that bacteria that has entered the bladder, so that you won't develop an irritation or an inflammation of the bladder, because those can be very uncomfortable too. Now, there are different medications for the bladder for different things. One size does not fit all. So when you go in and you tell your provider, my bladder hurts, it hurts when I urinate, I have to go all the time, it doesn't seem like I ever get finished. The first thing that you're going to have is a urinalysis, and that's where they have you catch the urine. The second thing they're probably going to want to do, if it keeps recurring, is a pelvic exam. Now, let me tell you this. A lot of times I know insurance is expensive, and then you come in and there's a copay, and you're just trying to cut a few corners. And so people will call me and say, "Hey, I've got a bladder infection. Call me in something." Well, the first time I might do that. But if you call me back in a week, or you keep calling me back, I've got another infection, I've got another infection, I'm going to insist that you come in, because things can happen to your bladder that need attention. It could be that the antibiotic we're giving you isn't sensitive, it's not effective against the bacteria that you have. So we need to send your urine to the lab where they will grow it on an agar plate and tell me what type of bacteria is causing the infection so I can match it with the proper antibiotic. Sometimes you can have polyps in the bladder. Bladder cancer can be an issue. So recurrent bladder infections are not normal and should be addressed thoroughly. Now, after I've done what I can do, I always suggest a urology consultation. And a urologist is the kind of doctor who works on the bladder or on the urinary tract and all the parts involved there. So if you keep on having those infections, ladies, that's what needs to happen. If you just expect to keep calling, send me an antibiotic to my drugstore, I have another infection, it's not going to happen. Any good provider is going to check out why you keep having those infections. And they can be caused by sexually transmitted disease. So if you've had a sex partner that you're not real sure about his history, or been involved in things that could cause sexually transmitted infections, you need to be tested for that. Gonorrhea, chlamydia, trichomonas, HPV, all those things are some things that can cause problems in the urinary tract. You can get lesions from syphilis in that area, and we do have quite a lot of syphilis in our area right now. So if you are sexually active, please know your partner and please use condoms for protection. And keep in mind that all of these things can be spread orally as well as other ways too. That's not out of the question. But again, incontinence is a problem for about 75% of women over the age of 65. Now, we're looking at it. They've come out with some new technologies for this issue, for bladder tone. It wouldn't help bladder prolapse. Remember, there's two things we're talking about here that are different. One is where the bladder muscle has relaxed and let the bladder fall down into the vagina. And one lady asked me, can my bladder fall out of my body? No, but it can fall down far enough that it sticks out of your vagina. And then in second to the prolapse is the muscle tone, the bladder tone. And this is one of the frequent causes of that leaking that is so unpleasant. It is a huge, huge market in pads that women wear because they have this leaking. I say, you can't sit down to watch TV without someone coming on with their pads and their little panties that they've created now. So yeah, it's a big market, but they've come out with a technology that we're looking at in my office. It's a chair that you sit in, and it has a magnetic field in it, but you sit in this chair for about 28 minutes, twice a week for about 3 weeks. And bottom line, what it's doing is it's replicating Kegel exercises, but instead of doing 10 Kegel exercises in a setting, it is doing thousands of Kegel exercises for you without you realizing that it's being done. And the treatment is very effective. Of course, the chair is very, very expensive, and so I'm not sure we'll be able to get that right away. But if we could, or if you find someone that has that chair, it's a very effective mode of treatment for that. But I basically want to bring you this information because many women suffer silently. If you visit nursing homes very often, and I've had occasion to visit nursing homes regularly, and you go in, many times you are greeted with the smell of urine. And that's because the majority of the women in the nursing home are elderly. They have no estrogen, most likely, in their bodies, so their tissues are weak anyway. They have lived their lives probably farming or taking care of their families and doing a lot of heavy lifting, and their bladders are they probably have both muscle weakness and a prolapsed bladder, and so they can't hold their urine very easily. And as a result, you smell the urine smell throughout the nursing home, which can be very unpleasant. I remember when my late mother-in-law was alive, she was just very private with everything, like most women are, and she didn't want to talk about buying any pads. She would, I believe, died before she would have gone into a store and bought a box of pads for bladder incontinence. So she would just simply take old towels and cut them up into rags or strips and make her own. And then she would launder them and use them again. So this has been a problem for women for years. It's nothing new. And you would think that with today's fitness programs, we wouldn't have that issue as much, but we do. And it's because women just don't talk about these things. Well, that's the purpose of this program that the Knox Media team has allowed us to do, is to bring you knowledge of these things that aren't usually talked about. So please don't be shy and embarrassed when you go to your provider's office because they don't know if you don't tell them. Now, oftentimes we can look and see prolapse, but surprisingly, prolapse doesn't cause the issues that this little slack bladder tone causes. I've had women come to see me and I'll do their exam and their bladder is staring at me before I even go inside their body. And I'll ask, are you bothered with leaking from your bladder? Oh, no, I don't have any problems with it. And I'm like, wow. Well, you should be, but they're not. But it's the woman who has no pelvic tone that suffers the most. So keep in mind the Kegel exercises, the weight loss if you need that, and it doesn't. You don't have to be heavy to have this problem, but if you are heavy, weight loss can help with that. There are medications that can be given to help with the frequency and the urgency. Make sure you don't have an infection. Drink plenty of water. The sodas are very acidic to the bladder lining. Caffeine is irritating to the bladder lining. So if you're bothered with incontinence for this reason, cut back on your caffeine use and drink more water. The aspartame and the saccharin, which are artificial sweeteners, are horrible for the bladder. They're horrible for the body. As you all know, I hate those, but they can be detrimental also. And then if nothing else is helping, you might want to try some of the devices like the Kegel balls, the physical therapy. There is a little device that you can be fitted with that helps prolapse. It doesn't really help tone that much, but it's called a pessary. And it's a little device that we put into the vagina and it stays there for several weeks. Usually you take it out and wash it off and put it back in, or your home health nurse that comes by for the elderly can change it out for you. So there are a lot of things that can be done short of surgery. Sometimes surgery is the answer, but sometimes you can do other things. So I always encourage you, don't suffer in silence. Ladies, we put up with enough stuff. So bladder leakage is one thing that we can do a little bit about. Check it out. go see your provider. Come by Options Wellness. We work on those things too and refer out to our urology friends when we need to. Again, it has been a pleasure to talk with you on the real world of women. If you have any topics you would like discussed that you're just embarrassed to discuss face to face with someone, send it to me. I'll talk about anything, as you know, and we give you the facts. You know, a lot of times there's fact and there's fiction, and I will give you facts that can be backed up with credible medical research. I appreciate you coming to see us. Thank you for your time. Oh, we got a couple of questions. Here comes the question lady. I always sit up straight when she comes in the room.
Okay, first question is, can you get a yeast infection in your mouth?
Yes, you can. You can. You can get a yeast infection in your mouth if you are diabetic and have too much sugar, if you take antibiotics. If you have oral sex and your partner has yeast on his penis, frequently in the uncircumcised male, you'll get yeast overgrowth. And if you have oral sex, you can get yeast there. One of the new medicines for weight loss, the way it works is it literally pulls 300 calories of sugar out of your blood every day, and you just urinate it away. But if you don't clean that sugary urine away, you're going to get a yeast infection. And then if you have sex, it can be passed different places.
Okay. Next question. Does semen cause pink eye if you get it in your eye?
It does not. Pink eye is caused by specific bacteria. Now, semen is very acidic and it can burn the delicate tissues of the eye. But does semen cause pink eye? No, it does not. It just causes fun. Have a good week, and we look forward to meeting with you again next week. This is Susan Bentley, Women's Health Nurse Practitioner at Options Wellness in Muscle Shoals.
Love and happiness, yeah. Something that can make you do wrong, make you do right. Yeah.